decreasing, the breast is increasing as well. So you also have irritations, you have dimpling of the breast skin, and that dimpling is what I explained earlier as the back of what's that, an orange, right? So it appears exactly that way, the back of an orange. Or for some reason also you can use goosebumps all over. When you experience goosebumps, you can see the person's breast that way too. You have redness of the breast, you have nipple discharge. Some people have discharge which is necessarily not breast milk. Some people can have yellow discharge, some people can have blood as well as pus. You also have change in the size and shape of the breast because it's thickening, and then there's swelling as well. You have pain in the area. Now, for common knowledge, breast lumps are usually painless. Remember that breast lumps are different from breast cancers, even though that in breast cancers, one of the signs and symptoms is breast lump, right? For breast lumps which are benign, which are non-cancerous, they are usually what's painless. But for breast cancers, every lump that you feel is usually painful. You find out that the patient becomes very irritable. Everything like it becomes very tender. That when you touch the patient feels a lot of pain. So that's one of the signs of breast cancer. So you have a lump in the breast, you have thickening, you have irritation and dimpling, you have redness of the breast, you have change in the structure, which is just like the dimpling, right? You have nipple discharge, you have change in size and shape of the breast. You also have pain in the area of the breast. Okay, so we would move to stages of breast cancer. I'll just mention it. You don't need to get the details. Stages of breast cancer, you have 5 stages. Goes from stage 0 to 4. So you have stage 0, stage 1, 2, 3, and 4. Just like we have in primary schools, you go from primary 1 to primary 5. What it actually means here is that for stage 0, you have lesser effects, you have lesser multiplication, you have lesser spread. To stage 1, to stage 2, to stage 3, to stage 4. So at stage 4, there's practically nothing you can do. Most times it's pressed to the lungs, it's pressed to other organs of the body, right? So you just understand, I need you to understand here that stage 0 to stage 4 means that as you are moving, it's progressing. There are a lot of complications that are involved as well, you understand? So the lesser the stages, the more the containment, the more you can handle it, the more you can use therapies to be able to excise the cancer cells and the rest of them. So we've moved from stages. We are going to talk about the treatment. How do you handle breast cancer? Most times, I don't know if I can actually agree to call this treatment because in Nigeria, it feels like we cannot treat breast cancer, though we are improving, right? But I would like to call it management because there's obviously a very huge line between treatment and management. So I would like to actually say, okay, this is the management of breast cancer, right? Okay, so for management of breast cancer, just like I said, it depends on the staging. So first off is when you go for your examinations in the hospitals and they're like, okay, you've conducted mammography and the rest of them, and they're like, okay, you have breast cancer. What happens is you are advised to do mammectomy. Now, it's either total mammectomy or partial. And what I mean by partial, I'm using this very linear name so that we can understand it. What I mean by partial is they are excising the part of the breast that is affected. And then total means that they are excising the whole breast. For some people, they also excise the lymph duct. And remember that I said that for spread of cancer cells, most times it spreads through the lymphatic system. So it is always advisable to take away the lymph, especially the ones under the arm. That is the axillary tail, because that's where spread mostly occurs from. So you have excision, that's surgical removal of the affected breast. You understand? So for someone that has breast cancer, especially starting from, let's say you have breast cancer on your left breast, what is done is they do mastectomy, they remove that particular breast, and then they monitor the next breast. Mostly what happens is it moves to the next breast. But for some very lucky people, maybe 2 to 5%, it doesn't tend to move to the next breast. But then 95% is a huge number. For most people, it has already moved. The only thing is that within few months, you find out that the other breast becomes engorged. And what happens? You excise the entire breast and then follow up with radiation, follow up with hormonal therapy, follow up with administration of drugs, cytotoxic drugs that help to suppress these cancer cells, suppress their growth factors, and prevent, to the best of the work of those drugs, their multiplication. So, like I said earlier, the first thing you do is that is done to manage breast cancer is surgical excision of the affected breast. Then they go in with radiation. They go in with hormonal therapy that tends to suppress the growth factors responsible for those cancer cells multiplying. And then they can also go in with chemotherapy, which involves administration of cytotoxic drugs. And cytotoxic drugs means drugs that are toxic to the cells which are multiplying. Yeah, so those are the basic management protocols. And then, very important, we understand that preventive medicine is more like the most important thing, most important unit of medicine, because if you're able to prevent a lot of diseases, a lot of exposures as human beings, you find out that you have lesser people coming to the hospital, right? So for prevention, I think this is the most important part of the whole lecture that I've been going through. So for prevention, I would like to say that there's no sure way to prevent breast cancer, but there are things that you can do to lower the risk, right? I remember that during my explanation for the causes of cancer, I said that there is no particular cause. However, you can have risk factors, things that predispose you to breast cancers. So what you do in prevention is lifestyle modification, especially for people that already have a genetic predisposition to cancers, breast cancers. So lifestyle modification means that you are expected to stop smoking, stop alcohol intake. You're expected to, when let's say you're overweight or obese, you work on your weight. You That's exercise, physical activity. For people that are not giving birth, I mean, there's nothing they can do. You can't tell a reverend sister to go and get married, right? That is her call. So for people that are not breastfeeding, let's say for mothers that usually don't like breastfeeding, they would like to give milk, you explain to them the importance of breastfeeding, especially exclusive breastfeeding, unless probably there are other factors to it that she cannot handle at the time. Yeah, so all those things I mentioned, the risk factors, you find a way to curb them, you find a way to prevent physical inactivity. You do probably walking. There are a lot of things that you can do in your room. You mustn't go out running. You understand? Those things help to prevent breast cancers. You also have a prevention of a probably intake of excessive hormonal therapy, intake of excessive birth control pills. These things expose your cells to excessive multiplication and the rest of them. So when you are you we try as much as possible to inform very young ladies that are not so enlightened on birth control pills. I mean, every month you are taking birth control pills and the rest of them, to have a stop to it, because I mean it's not just about your reproductive system. It's also about the effect it's going to give eventually. It might not just be then, it might not just be at the time that you're taking it. It might take years. You understand? Now, also, we also try to create awareness in the community at the community level, because awareness, especially using breast self examination, because people do not actually have a breast lump, you should report to the hospital. So that these are the things as medical personnel that we try to do. We create awareness, just like I'm trying to create now. What you are supposed to do to prevent it. I mean, you do the best that you can do and leave the rest for God. So you also have a cancer screening, which is a mammography. Now, what happens is as you age, you are more predisposed to having this cancer. Also having cancer. So for mammogram, expected to do mammogram every year. Now, as you proceed, as you go, as you age, the time interval reduces. So for someone that is between 50 to 55, it becomes every 2 years, and vice versa. So we'll move to breast self-examination because that's the most important form, I would say, of preventing breast cancers. So for breast self-examination, please can I have the diagram? Alfred, please can I have the diagram for breast self-examination? Okay, so for breast self-examination, there are three methods to it.